Now, every year, February 4th marks World Cancer Day. It is a day set aside to raise awareness about cancer and push for better care of patients. Now, in Sudan, health experts say the number of cancer cases in the country has increased since the outbreak of conflict in April 2023, and that is due to lack of screening, treatment, and medical supplies. CGTN's Sharon Baranga tells us more.
The Port Sudan Oncology Center in Sudan's Red Sea state has become a place of refuge for cancer patients and their loved ones. Staff at the hospital have been overwhelmed by the number of patients they receive every day. Currently, the hospital has more than 3,000 cancer patients in its list. Medical staff who are already working in challenging circumstances are struggling to treat the huge number of patients. The devastating conflict between the Sudanese army and the Rapid Support Forces has forced 70% of hospitals in the country to close their doors. More than 17 doctors have been killed since the fighting started. That's according to the Sudanese Health Ministry. As a result of the closure of hospitals, the number of radiation cancer machines in the country decreased from 5 to only 1 machine in the River Nile state, which is not enough to serve the patients of that state, let alone 17 other states.
The truth is that there is scarcity of treatment for cancer patients, and it is also expensive. After April 15, 2023, the situation changed in Sudan, and the health sector was affected by the conflict. A number of factories specializing in making medicines went out of service. This includes pharmacies. The situation became somewhat miserable. Before the conflict began, there were 5 treatment radiation devices in Sudan. But after the devastation that befell Khartoum state, Gezira state, and its capital, Wad Madani, most of the treatment devices went out of service and hospitals were destroyed. We now have only 1 radiation device.
For families with cancer patients, getting treatment and care for their loved ones' needs has been difficult.
Since we came here after the conflict, the treatment has not been available and there's no special section for children with cancer. Recently, Madini Center was opened, but people are still suffering from interruptions due to lack of enough medicine. My son's illness in the pelvic area started as a tumor. Then we did a biopsy and it turned out to be cancer. And after that, we moved to Al-Amal Tower of Dr. Al-Khatib and we began to follow up with him in Khartoum before the conflict. We took doses and radiation and we are still following up with him.
Sudan's health ministry says the number of patients visiting the Port Sudan Oncology Center after the centers in Khartoum and Gezira states stopped operating has increased from 40 to 70 patients per day. The WHO describes the cancer situation in Africa as disheartening. In 2020, approximately 1.1 million new cancer cases were reported on the continent, with around 700,000 deaths. About 50% of new cancer cases in adults in Africa are due to breast, cervical, prostate, colorectal and liver cancers. The Global Health Agency warns that if urgent measures are not taken, cancer mortality on the continent is projected to reach about 1 million deaths per year by 2030. Sharon Baranga, CGTN.
Now, Nigeria's worsening economic